Hi, this is Tiffany Weinsheimer, and my presentation is on mandatory overtime. The learning objectives. At the end of this presentation, the learner will be able to define mandatory overtime and one implementation for and one against such. List 2 problems a patient can incur when a nurse is mandated to work overtime. And list 2 negative impacts on society when implementing mandatory overtime. Overtime is defined as working over 40 hours per week, according to writers. The American Nursing Association, or the ANA, commended the introduction of the Nurse Overtime and Patient Safety Act. This act was introduced to legislation in March of 2024. The ANA advocates for nurses to relieve them of mandated hours and overtime, and prevent safety issues. The Academy of Medical Surgical Nurses, or the AMSN, states that mandatory overtime should only be voluntarily due to increased nurse burnout and risk for errors. Influence on mandatory overtime on the nursing practice. Some of the positives are working mandatory overtime can financially help the nurse make more money. According to O'Hare and Reed, in April of 2024, an RN over the age of 35 can make between $89,000 and $96,000 a year. This helps to save money, pay off loans, or support a family. Overtime is also a short-term fix for staffing and in most healthcare operations. Making it mandatory for nurses to work over their scheduled time allows the facility to operate with fewer nurses and fill in gaps for staffing. Fortunately, most states in the United States do not legally impose mandatory hours on nurses. Some of the negatives. Due to the COVID-19 pandemic, some new nurses have become burnout faster. This leads to decreased performance and increased stress levels. This may be due to verbal abuse from physicians or verbal or physical abuse from patients and family members. The article by Sung-Hyu Bae, an RN, states that the adverse effect on overtime is a decrease in the nurse's health. This can be mental or physical, causing the nurse to call out. This then increases the workload for others who are working. More patients needed to be cared for with less staff. The nurse also feels guilty about taking breaks during their shift, and the decreased morale occurs within the unit. Influence on healthcare and society. Nurse Bae also stated that if the nurse's scheduled days off are filled with mandatory overtime, the risk of medication errors, pressure ulcers, increased infections like MRSA and ventilator-associated pneumonia, and patient falls due to exhaustion of the nurse leads to increased adverse patient outcomes. A study completed in South Korea took nurses from a hospital setting who worked only 40 hours, and then ones who worked over 40 hours and gave them a competency exam. The ones who worked fewer hours could score better on the skills being performed than the others. Then it was concluded that increased policies are needed to prevent adverse patient outcomes. The ANA stated that there is a global shortage of nurses. Mandatory overtime increases nursing burnout, and the nurses intend to leave the job or even the profession, causing more of a shortage. Increased nurse turnover and absenteeism due to a burnout can lead to higher recruitment and training costs for organizations. Additionally, medical errors or increased adverse patient outcomes can lead to legal and insurance issues. In conclusion, mandatory overtime in nursing presents significant challenges that impact healthcare providers and patient safety. While some arguments may favor overtime to meet staffing needs, the risks associated with mandated scheduling are substantial. Increased nurse burnout, heightened potential for errors, and the negative consequences for patient care validate the need for an alternative staffing solutions. Legislative measures such as the Nurse Overtime and Patient Safety Act are essential to address these issues, advocating for a healthier work environment and improved patient outcomes. By prioritizing the well-being of nurses, the healthcare system can increase the quality of care provided to patients while reducing the strain on the nursing workforce. Healthcare stakeholders must recognize the detrimental effects of mandatory overtime and work collaboratively towards sustainable practices that uphold the nurses' and patient safety. and here are my listed references.